Question 1. Patrick has smoked for 40 years, which increases his risk of emphysema and chronic bronchitis due to harmful chemical inhalation. This results in reduced gas exchange and loss of elastic recall, leading to air being trapped in the alveoli. Due to chronic bronchitis, excess mucus builds up, causing the airways to get blocked, and therefore all of these factors would be contributing to Patrick's respiratory symptoms. Furthermore, Patrick is experiencing tachycardia, which is evidenced by his increased heart rate of 155 beats per minute, but normal heart rate is between 60 to 100 beats per minute. And this may be due to heart damage caused by his myocardial infarction at age 68. And worsening left-sided heart failure. As well, Patrick will have reduced oxygen saturation due to his COPD, and his heart is overcompensating for the lack of oxygen, and therefore beating faster to pump blood to blood tissues.
Hypertension is a significant factor of left-sided heart failure, as it requires the heart to work harder to meet the demands of pushing blood throughout the body. Left-sided heart failure contributes significantly to Patrick's increase in heart rate. The heart's main pumping power comes from the left ventricle that is gradually weakened in left-sided heart failure. In heart failure, the stroke volume, which is the volume of blood pumped from the left ventricle per beat, becomes inadequate as the heart loses its ability to contract and relax normally. Due to the decrease in stroke volume, there is an increase in heart rate as the heart must maintain the cardiac output. Cardiac output is the amount of blood the heart pumps per minute. It is dependent on the heart rate, contractility, preload, and afterload. Patrick's body mass index is currently sitting at 29.3, which puts him in a category of overweight. Excess fat may cause your heart to work overtime because extra body weight restricts the flow of blood through your arteries and veins. Due to being overweight, the heart muscle is weakened from inactivity, and to compensate for this weakened state, the heart must beat more frequently to meet the body's oxygen demands. Another contributing factor for an increased heart rate is Patrick's diabetes. High glucose levels result in fats and sugars circulating throughout the bloodstream. This causes a high incidence of coronary artery disease. COPD is an umbrella term including emphysema and chronic bronchitis. COPD means chronic obstructive pulmonary disease, which is the result of abnormal immune response causing an increase of inflammatory markers such as leukocytes, ketokines, and chemokines. The inflammatory response is dominated by neutrophils, increase in macrophages and lymphocytes, predominantly CD8 cells. In Patrick's case, cigarette smoking is the main leading cause of his COPD. His age is another risk factor, which may contribute to his COPD. Cigarette smoke contains an extremely high concentration of oxidants. These reactive oxidant substances generated by smoking induce inflammation in the lungs and its airways. Psychologic changes which with normal aging are characterized by significant reduction in the elastic recall of the lungs, greater chest wall rigidity, and loss of power in the respiratory muscles. When Patrick is diagnosed with COPD, the fibers that make up the wall of his alveoli become damaged because of the increased release of protease enzymes from neutrophils and macrophages, leading to emphysema. In the meantime, the inflamed bronchial tubes make the airway narrower. It also produces more thick, sticky mucus. This condition is known as bronchitis. Bronchitis leads to the symptoms of coughing and difficulty breathing, which is evident with Patrick's experience. Patrick's left-sided heart failure may be caused by his hypertension, coronary artery disease, and diabetes. Hypertension refers to the pressure of blood in arterial circulation. When Patrick developed hypertension, it requires extra work of his left ventricle to pump blood out of the chamber into circulation against the increased force. After a long time overload work, his left ventricle became weaker, which led to left-sided heart failure. In addition, the backup of blood due to the weak ventricle contraction goes into his lungs and this in turn leads to pulmonary edema. The leakage of fluid into the air spaces of the lungs, leaving less space for gas exchange. This is the reason why Patrick is experiencing dyspnea. Patrick's high LDL level, low HDL level, and previous diagnoses of myocardial infarction indicates his coronary artery disease. Which is a condition defined as narrowing of the coronary arteries due to a buildup of plaque. This plaque is a mixture of cholesterol and white blood cells, and often hard shell of calcium forms on the top. This condition stops his left ventricle to pump efficiently, which would eventually lead to congestive heart failure. In addition, his diabetes is another risk factor. Diabetes means more sugar and fat circulating in the bloodstream, which may increase the risk of atherosclerosis, which is known as one kind of coronary artery disease that may result in left-sided heart failure. There is a correlation between COPD and left-sided heart failure. COPD causes difficulty breathing, which will decrease the efficiency of gas exchange. It will then cause a decrease in the amount of oxygen available in the body. This is inclusive to the heart. As known, the heart is an organ that constantly receives blood and pumps it out to supply all the organs, and the left ventricle is the main chamber that is responsible for pumping blood out from the heart. Insufficient oxygen will not meet the need for normal metabolism of heart cells, which will eventually lead to left-sided heart failure. On the other hand, when Patrick developed left-sided heart failure, more backup of blood from the ventricle goes into the lungs, causing pulmonary edema, which will lead to COPD, or worse, existent COPD condition. Patrick is now at risk of developing right-sided heart failure. Right-sided heart failure may be triggered by left-sided heart failure and pulmonary disease. Peripheral edema is a sign of right-sided heart failure. When the left heart fails, one consequence is that a lung vessel are often overfilled with blood. Consequently, the right ventricle needs to contract really hard to move blood forward into the lungs. Over time, it leads to right heart failure. And because of Patrick's COPD, it would result in pulmonary hypertension due to a narrowed, blocked capillaries. This will furtherly increase the burden of his right ventricle to pump blood into his lungs. When the right heart fails, blood cannot move into the lungs very well. It will then back up into the right atrium and then in the venous circulation. Blood will then accumulate, causing enlarged veins and organs. It will also increase the pressure of small capillary, opening more fluid exits and reducing fluid return, leading to edema that occurs on Patrick's legs. So, due to this COPD and left-sided heart failure, Patrick is now at risk of developing right-sided heart failure.
Question 5. Patrick's sodium blood levels are evaluated indicating hyponatremia, which usually occurs as a result of dehydration due to low blood intake or other illnesses affecting fluid balance. In addition, Patrick's evaluated glucose level indicates his pancreas is not secreting enough insulin convert glucose to glycogen, which may indicate type 2 diabetes, which also alert blood sodium levels. Hyponatremia can cause swelling in the legs and hands due to edema, along with tachycardia and a neurological dysfunction. Patrick's potassium levels are increased, indicating hyperkalemia, which is usually an indicator of kidney disease. This is very possible in Patrick's case considering his left-sided heart failure, which inefficient cardiac output triggers the red system to active and prioritize blood flow to the brain, heart, and lungs, therefore reducing renewed blood flow and causing peripheral edema. Patrick evaluated glucose can be an indicator of type 2 diabetes and causes changes leading to hardening of the blood vessels. Damage can cause nerve damage. Finally, Patrick evaluated triglycerides, and LDL, can lead to lipids building up on the artery walls, leading to atherosclerosis. The fatty plaque deposit can restrict blood flow through arteries. Patrick has a low level of calcium in his blood, is known as hypocalcemia, and can happen for a number of reasons, such as renal disease resulting in more calcium being secreted in urine, making it harder for kidney to activate vitamin D. Patrick blood results can also indicate a low level of hemoglobin, which indicates reduced red blood cells, which can lead to anemia with clinical features such as shortness of breath and tiredness. Patrick high density lipoprotein is considered good cholesterol, and therefore a low level of HDL is not desirable in maintaining protection from bad cholesterol (LDL). HDL removes bad cholesterol from artery walls, which protects the arteries from blocking and cause heart attack or stroke. In Patrick's case, his long history of smoking and sedentary lifestyle have contributed to his decrease in HDL.
Chronic obstructive pulmonary disease is characterized by lung inflammation that persists after smoking cessation. The key inflammatory cell types involved are macrophages, neutrophils, and T cells. Neutrophils serve a key effect in the immediate immune system. They provide the first line of defense against invading organisms. Cigarette smoke activates macrophages in the respiratory tract and release neutrophil chemotactic factors including IL-8 and Lqb. These cells then release promises that break down connective tissue in the lung peritoneum, resulting in emphysema. After smoking cessation, there is a progressive airflow obstruction in patients with COPD. This is due to accumulation of inflammatory mucus, exudates in the lumen, and increase in tissue volume of bronchial walls. Patients with COPD have an ongoing active immune response resulting in chronic inflammation of the lungs. Therefore, there is less likely to be a higher neutrophil count in the blood.